Most people assume that regular health checkups are always beneficial. But what if, past a certain age, some of them could actually increase your risk instead of protecting you? It might sound counterintuitive, but the truth is not all medical screenings are harmless. In fact, some of the most common tests offered to older adults can lead to false alarms, emotional stress, and even risky treatments. That's not scare tactics. It's something more and more doctors are beginning to realize, especially when caring for patients over 70. Modern medicine is finally starting to accept an uncomfortable truth. When it comes to aging bodies, one-size-fits-all testing can sometimes do more harm than good. In this video, we're going to look honestly at 5 specific health screenings that many seniors are better off avoiding. Tests that even many doctors choose not to undergo themselves. You'll learn why these procedures are still widely recommended, the hidden downsides they carry, and safer, smarter alternatives that prioritize your well-being without exposing you to unnecessary risk. If you're someone who values your health but wants to avoid being over-tested, over-treated, or overwhelmed by today's healthcare system, this video is for you. We're not here to create fear. We're here to give you clarity, confidence, and the knowledge to make wiser decisions in your 70s and beyond. Let's begin. 1. The colonoscopy dilemma. Colonoscopy has long been considered a gold standard for detecting colon cancer, especially for people in their 50s and 60s. But after age 70, particularly for those without symptoms or a strong family history, this test can quietly shift from helpful to harmful. What was once a potentially life-saving screening can become a source of physical strain, emotional anxiety, and in some cases, hospitalization. Why? Because the procedure isn't as simple as it seems. It requires a full bowel cleanse, anesthesia, and the insertion of a long scope deep into your digestive tract. That alone is taxing at any age, but for older adults, it's even riskier. The bowel prep can lead to serious dehydration and electrolyte imbalance. The sedatives used can linger longer in the system, leading to dizziness, confusion, and falls. And the aftermath, often more complicated than expected. One of the biggest issues is what happens after the test, especially if doctors find small polyps. These growths are often slow to develop and may never become dangerous. But once found, they tend to trigger a cascade of further testing, biopsies, and sometimes even bowel surgery. Take George, for example. He was 82, healthy and full of energy. But after being persuaded to get a routine colonoscopy, things went downhill. The prep dehydrated him, and after the procedure, he became disoriented, fell, and fractured his hip. The test, completely normal, but the recovery took months. Doctors mean well, of course. They're doing what they've been trained to do. But the science is evolving, and so should we. Are over 70 with no digestive symptoms, it's perfectly reasonable to decline a colonoscopy. There are non-invasive stool-based tests that can detect early warning signs without putting your body through unnecessary stress. This isn't about neglecting your health. It's about protecting it more thoughtfully. 2. The trap of full-body scans. The idea of a full-body scan is undeniably appealing. A machine that can peer into every corner of your body and catch hidden issues before they become problems. Sounds like smart prevention, right? But for people over 70, full-body scans can cause more harm than good. These scans, often CTs or MRIs, are powerful tools, but their strength is also their weakness. They pick up everything, including harmless or age-related abnormalities that will likely never affect your life. Doctors call them incidental findings, but to you, they become scary mysteries, shadows or nodules that might be nothing, or might be something. And just like that, the testing spiral begins. More appointments, more specialists, more biopsies, and sometimes unnecessary surgeries. This is especially dangerous for seniors whose bodies don't bounce back like they used to. What was once a simple outpatient procedure could now involve serious complications, infections, or extended recovery. Betty, Age 78 is a perfect example. She was active, healthy, and felt great. But after getting a discounted full-body scan at a health fair, she learned about a tiny lesion on her kidney. It was likely harmless, but she panicked and agreed to surgery. The result? Months of fatigue, complications, and a loss of vitality she never fully recovered from. And here's the kicker. These scans are rarely covered by insurance. Many seniors pay out of pocket, thinking they're buying peace of mind. In reality, they're buying a ticket into a system that often never stops scanning. At this stage in life, real wisdom means knowing when not to go looking for trouble. Trust your body. Tune in to how you feel, not just what a machine says. Not every shadow on a screen deserves your fear or your energy. 3. The misuse of cardiac stress tests. For decades, treadmill stress tests have been a routine way to check heart function, especially for older adults. The concept is simple. Push your heart and see how it responds. But after 70, this test can lead you down a road you never intended to travel. That's because stress tests in older adults often produce what's known as false positives. They suggest there's a problem when your heart is actually functioning just fine. As we age, our arteries naturally stiffen, our heart rhythms shift, and blood pressure fluctuates more. None of which automatically means disease, but the machine can't distinguish normal aging from danger, and so it raises red flags. That's when the chain reaction begins. Cardiologists, angiograms, stents, and sometimes bypass surgeries, all based on a test that may not have been needed in the first place. George, 74, had no symptoms, no chest pain, no shortness of breath. But during a checkup, his doctor recommended a stress test. One borderline result later, George was in for a catheterization. A month later, he was in the ICU with an infection from the procedure and never fully recovered. More and more cardiac experts now recommend skipping routine stress tests in seniors who have no symptoms. If you're not having chest pain, unexplained fatigue, or shortness of breath, you probably don't need it. What you do need is movement, good food, rest, and meaningful social connection. That's what keeps your heart strong after 70. Not machines, not wires, not unnecessary tests. 4. The hidden costs of repeat colonoscopies. The fear of colon cancer runs deep, and for good reason. It often appears without warning. But that fear sometimes pushes people into procedures that no longer serve them. Let's be clear. Colonoscopy is a valuable tool, but if you're in your 70s or 80s and already had normal results in past screenings, repeating the test may carry more risk than benefit. Older adults are more vulnerable to complications from anesthesia. The sedatives used can lead to prolonged confusion, brain fog, or even long-term cognitive issues. The bowel prep can cause dehydration and kidney stress, and for those who live alone, the physical strain, including falls during the prep phase, is real. And again, consider the time horizon. Colon cancer develops slowly. A polyp that might take 10 to 15 years to become dangerous may not ever become relevant in your remaining years, especially if you're symptom-free and had prior clean tests. Eileen, 78, had 2 normal colonoscopies earlier in life, but her doctor recommended another, just to be safe. During the procedure, her colon was accidentally perforated. Emergency surgery followed, a month in the hospital, and life was never quite the same. If you've had previous clear screenings and have no warning signs like blood in your stool or weight loss, you're allowed to say no. Focus on real symptoms, not just routine. 5. The stress test spiral, revisited. There's something about the heart that evokes deep worry. It's the organ we associate most with life itself. So when doctors suggest stress tests just to be safe, many seniors say yes, even without symptoms. But here's the truth. Age-related changes in the heart are normal, and when interpreted too aggressively, they can send you down a spiral of interventions that cause more harm than help. Harold, 76, was feeling great. His stress test found a minor irregularity, which led to a catheterization and a stent. Afterward, he developed internal bleeding from the blood thinners and was hospitalized for weeks. There was no chest pain, no shortness of breath, no fatigue, just fear, and a test that snowballed into a crisis. Studies show these stress tests rarely reduce heart attacks or improve survival in older adults without symptoms. They create risk where none existed. Real heart care after 70 is about lifestyle: walking, sleeping well, eating fresh food, staying mentally and emotionally engaged. The machine doesn't know what matters to you, but you do. Final thoughts. Getting older doesn't mean giving up. It means growing wiser. It's about understanding that healthcare should serve your life, not take it over. In today's world of more tests, more diagnosis, more treatment, sometimes the most courageous choice is to say, no, thank you, not out of fear, but out of clarity. Because at this stage, your peace of mind, your time, and your dignity are what truly matter. So don't be afraid to ask questions. Talk to your doctor. Make choices that reflect your values, not someone else's protocol. Saying no to a test isn't ignoring your health. It's protecting it. And you've earned that right. If this video gave you a new perspective, share one takeaway in the comments. And if you found it valuable, please like, subscribe, and pass it along to someone you care about. We'll see you in the next video.